I don't
Sure.
know. I don't know what SARMs are. I've known about them on the periphery for a very long time, but I don't have any experience in it. So I'm not really sure what that is or why it's illegal.
So you've seen them advertised, right? You see them
Yes. Right.
on online or even
Yeah.
some mom and pop health food stores,
Yes.
nutrition stores have been selling it. Okay. So the SARM is just an acronym for a particular, right? It's a
Yes.
selective androgen receptor modulator, a selective androgen receptor modulator, which when you think about it means why you're taking steroids, right? You're taking steroids to bind to the androgen receptor in the body, right? So
Hmm.
that you will get in the muscle tissues increased protein synthesis and ultimately hypertrophy from what happens in the muscles, right? Because your
Okay.
muscles have androgen receptors. There's also androgen receptors in other parts of your body, right? So the scalp, the skin, the prostate. So you don't want those
Right.
androgens to bind to the receptors in your prostate because you don't want a prostate the size of a watermelon, right? If you can avoid it, that's
Right.
not something you want, right? You don't want them to bind in the brain or in the skin to give
Right.
you some extra acne, right? You don't need any of that. So if you can create a chemical that selectively binds only to the muscle and
Hmm.
not to the other androgen receptors in the body, then you've
Okay.
got like something that's works like a steroid, but yet doesn't do some of the negative effects of it. The
Hmm.
problem is
There's also SERMs, the
right,
other side.
which are the estrogenic. The idea in theory sounds good, but
Yeah.
there's a couple of problems. There's a problem from a health perspective is that from all reports, and there's not a lot of studies, but it's suggested that it's not perfect in terms of completely selecting the places you want it to go and not the places you don't want it to go. So there's some anecdotal reports, and John, I'm sure you've heard them too, of people getting some suppression of their own testosterone production because of SARMs. You've got some side effects that are steroid like, acne, all the other things that might go to maybe on a lesser degree, but still causing them. It's not a perfect exclusion of the androgen receptors in the places you don't want the androgens to go. So
Right.
that's one of the problems. The other problem is there's not a lot of research. Ostarine, which is one of them, is being studied for a pharmaceutical drug, right? So it's going through the phase 1, 2, and 3 clinical trials that
Okay.
FDA uses to approve a drug. But a lot of the other ones, it's bro science, right? It's
Yeah.
just
Right.
guys, anecdotal reports, the dudes in the gym. And Frank, we see them all the time. They're using SARMs and you don't really know what the effects are. So you've got this question of inadequate research. So when FDA looks at that, FDA says, wait a minute, in order to bring a drug to market, you've got to spend millions and
Hmm.
billions of dollars to bring a drug to market with all the testing that's required, et cetera. How do we allow somebody to just put some stuff in a bottle and sell it on a health food store shelf, right? So the FDA doesn't like it. And
Right.
so they view it as an unapproved drug. It's a drug that hasn't been approved by them. And it's
Mhm.
a crime to sell unapproved drugs. You're not a pharmacist. The drug hasn't been approved. We have a closed system, right? If you want to sell drugs in the United States, you got to be a pharmaceutical company and you got to be a pharmacy that dispenses them and a doctor that prescribes them. That's the drug system. So if you're
Right.
selling unapproved drugs into interstate commerce, that's a federal crime. And so
Mhm.
one of the ways that guys have tried to get around that is to say, we're not selling drugs.
Yeah.
We're selling chemicals not to be used by humans. So we're selling this not for human consumption as a research chemical. And
Okay.
there's some argument that if it's purely not for human use, then it's not a drug, right? So
Right.
you found a little loophole that allows you to sell it. The problem is that everybody knows that's not what it's being sold for. So that the devil's in the details. And if you're selling it on a health food store shelf or on a website that's nutrition based and you're mailing it to private home addresses and you're
Yeah.
selling it to people whose email addresses are youngandjacked at gmail.com, then there's a name for that. in the eyes of FDA, and it's fraud. You're fraudulently calling it a research chemical and
Okay.
fraudulently saying it's not for human use when it's painfully obvious that's not true. And the FDA has gone after, and Department of Justice has gone after people for doing that. And I've represented many of them. I've gotten great results on the cases, but it's not, nobody wants to be on the bad end of an indictment in federal court, right? And
No,
so that's the
certainly not.
legality.